Well, hello everyone. I'm Demi Vaughn with the Power of the Patient Project. Today we are joined by the renowned best-selling author and women's health expert, Dr. Shery Ross, an OBGYN in Los Angeles. She's better known to her patients as Dr. Shery. Dr. Shery earned her MD degree at New York Medical College and spent her OBGYN residency at the University of Southern California School of Medicine. In addition to Dr. Shery's busy practice, she also serves on the board of Planned Parenthood in Los Angeles. Dr. Shery, we want to thank you for joining us today.
Thank you so much for having me.
Yeah, so we're just going to jump right into our questions. I know that you've accomplished so much in your career. Was there a significant experience that happened to you that made you interested in pursuing your focus in women's sexual health?
Well, thank you for having me. Thanks for commenting on this. The truth is, over all this time, I always say my best conversations are when a woman's legs are up in stirrups. Truly, there's a lot of misinformation, but sexual wellness is even more under discussed. So that's where I was going to really lean into this conversation based on what I was hearing from my patients.
Yeah, and it's great to hear you say that because that basically piggies us into our next question about some of the most common stigmas surrounding women's sexual health. What are some of the most common stigmas that you've heard women say and that you've just heard like during your practice surrounding women's health? And are there any that you can debunk for us?
Yeah, I think one of the most common is practicing safe sex. What is it? And do I do it on the first date or second? I mean, what is it? And this is one of the most common because safe sex is really having your partner, if you're with a man, having him wear a condom during any vaginal or anal intercourse and even with oral sex. So you got to put the condom on before you give oral sex to a man or a woman, using a dental dam if you're giving oral sex to a woman. And no one does it. I mean, no, I haven't heard anyone really give a blowjob with a condom on. Have you? Yeah. So
No, I have not.
So I think this is one of them that I hear all the time. And or piggyback on that is, my partner was checked for STIs and they were negative, so we don't have to wear a condom. And again, HPV, which is probably the most common STI out there, herpes, you can't check for, beforehand. So these are very, very common. And then how often do I get checked for STIs? And that's also sort of a mystery because it's really not after just having unprotected sex with a partner. It's once a year or after you end a relationship, you should get checked. So these are kind of common ones that I hear all the time. Bigger is better. I think this is created by men. This myth that women enjoy, a bigger penis if you're having heterosexual, penetration. Of course, this isn't true either. Can I get pregnant I can't get pregnant on my period. This is another one. I mean, it's very common to hear this one as well. Female ejaculation is a myth. I mean, squirting is not a myth. Women do it up to 50%. I mean, it may happen once, but it does happen. So these are some of the common ones.
Yeah, and what do you think that like people could be doing to educate themselves on like their sexual health? Like what are some ways that people can just like educate themselves and like learn real things and real facts about sexual health, particularly for women?
I mean, it's really such a good question. And everything medicine is your source, right? So, I wouldn't necessarily go to, the Kardashians for body image, examples. And I think you always have to look towards where you're getting your information because you can't always get it from your doctor either. I mean, part of this issue of why people are so confused and misled is they don't really know where to go. So I think it's looking at who are experts in their field that's focused on sexual wellness, and not necessarily social media influencers that talk about sex, because there are many out there. I think it's looking at the credentials, looking at where they were educated, and there are people that just do sexual wellness. So I think that's where I would sort of recommend people starting their journey.
Yeah, and I think that definitely makes sense. I mean, without like resources available to some people, like they might not be able to get the accurate information when it comes to their sexual health. So that actually brings me to my next question. Considering the recent Supreme Court decision to overturn Roe versus Wade, what do you think the future of women's health looks like? And how can people help to restore equality?
Yeah, I mean, this is just, we are in crisis mode right now in this country. And certainly, women's reproductive rights are in jeopardy. It's a crisis. I mean, it's just a sad moment that we are going back with reproductive justice. And I'm afraid for what's going to be happening sort of in these states where you cannot access, abortion care, which is healthcare. American College of OBGYN, sort of where I get all my sort of guidance of standard of practice, is very upset also because abortion rights are healthcare rights. I think it's really, again, educating yourself, on birth control, on making the decisions, because it is up to us to practice birth control, safe sex. And of course, a lot of the women that are affected are in the lower socioeconomic branches, minority women who, really, some can't even access birth control. So it's educating, and it's voting. I mean, this is really what this is about. I mean, we need to elect officials that think like us. The minority that represent the Supreme Court really don't represent the majority of women and men that are in support of reproductive justice. So it's the conversation. It's what we're doing here today. It's viewers who may get off this Zoom and donate $1 or $3 to Planned Parenthood or to some of these other services that provide healthcare for women.
Yeah, definitely. So what would you say are some things that young women could be doing as they reach that, like that age where you have to like really start taking like your sexual health seriously? What are some things that like young women and maybe even like parents of those young women could be doing like early on with their daughters, their nieces, whoever it may be, to help them like protect themselves against those diseases and complications that come up with women's sexual health?
It's from an early age, where you're learning about your body parts, where you're learning about the vulva is the outside of the vagina, and then the vagina itself. You're learning about your breasts. You're learning the right terms to talk about your body. I think one of the things I see, and the moms bringing their daughters reluctantly for an exam, and not necessarily that you need an exam. 13 to 15 is when you may come to your gynecologist, but certainly not to get a pelvic exam. It's the start of a relationship. And sometimes when I see young, teens, we just sit in my office and talk. It's about finding a healthcare provider, and some pediatricians do adolescent medicine, that can communicate and make a connection and to educate. It's all about educating. And it doesn't necessarily mean if you're going to get on birth control that you're going to be sexually active. And this is why a lot of moms are reluctant to bring their daughters in, because then they are allowing them to have sex. And it's, so I think it's just, we all need sort of this grassroots movement. And it may not be your mom. It may be your godmother. It may be your aunt or your big sis that's going to educate you. You sort of have to know your vulva well. You need to know where the clitoris is, because you want to start to learn about embracing your sexual wellness and masturbating. And yes, it's okay, and you should do it. Because if you don't do it and know what you like, when the time is right and consensually that you want to engage, and not necessarily penetration, it could just be kissing. But you really need to know your body. You need to know where your parts are, what they're for, how to protect yourself if you are going to take the responsibility of being sexually active and you're engaging with someone that can get you pregnant. Straight sex, you need to be on birth control. You have to rely on yourself. You really do. And this gets back into sort of the whole misinformation about, sex itself, and that's for men, and men have higher sex drives. And none of this is really true. I mean, we're sort of equal in that regard. But, learning the right words and the terms from an early age.
Yeah, I think it can just be really like awkward for parents, and just like awkward for like young women and just young children in general to like talk about these things and like learn like what the parts are actually called. So yeah, I definitely agree with everything that you just said. So I know that you had a lot to do with the stress echocardiogram test for women. So I would love if you could elaborate more on exactly what that test is and when women should begin testing.
Yeah. So, we always worry about breast cancer, but the truth is heart disease is what we are more at risk for. 1 in 4 will die of heart disease. So I'm a huge advocate. I work with the American Heart Association. Sort of as a result of being an OBGYN, pregnancy is like the first stress test. So we can identify women at risk. So fast forward to a stress test is one of the ways your heart is evaluated. And you're basically running on a treadmill, sort of at an uphill decline, and you're getting your heart first ultrasounded to see how it's pumping. You get all these leads on your chest to then walk you over to the treadmill, get your heart rate up to 85%. It's sort of normal heart rate. And then you get off, and meanwhile you get back on the gurney and get your heart looked at again. And that's kind of an echo stress test, short version. But a patient of mine who I'd sent to get screened, her father had died of a stroke at 63. So she went in and she did the test. She called me after, and she's like, do you know you run on this, treadmill as fast as you can and at an uphill incline, and you don't wear a bra? And so this led she and I to create a bra for women to wear during this test. But just like so many things, are marginalized women. The studies don't include women, at least to the same degree as men. And so who would think that women would need a bra when they're running on a treadmill? So that's how we sort of created this bra. And it also encouraged my interest to continue for women in heart disease.
Yeah, that's awesome. Where can people purchase the bra?
Well, again, it's on our website. Heartlanta is the name of it. Heartlanta bra. We're just introducing it. As everything, it's who's going to pay for it. It really, you would think the cardiologist, when they identify that you have risk factors, that they would tell you that, oh, by the way, you don't need a bra. But of course, that doesn't happen. So right now it's on our website to purchase, but hopefully it seems like it would be something that, insurance companies or even the manufacturer of the machine would make. But we're still figuring that out, So right now some women are buying it from our website.
Okay. That's awesome. Yeah. I'm definitely gonna like look into that. So like at what age should you start getting the test?
Yeah, well, so there's really no test, age, right? It's like pap smears, mammograms, there's a little more guideline. I think this is another issue. If you have any risk factors, you have heart disease in your family, you have high blood pressure, diabetes, maybe you had high blood pressure in your pregnancy, preterm labor in your pregnancy, this sort of puts you at risk. I like to send my patients to the cardiologist at around 50 to get assessed. And this is, again, there's sort of no guideline, but we really have to look at our own family history and some of our medical problems, ask questions, that again, we always have to be our best healthcare advocate.
Yeah, definitely. And that is what the Power of the Patient project is all about. So
Love
I'm
it. I
glad that
love it.
you hit on those points. But like I mentioned earlier, you are a best-selling author. So can you tell us about your two Sheology books and if you plan to make Sheology a trilogy?
I know. Well, let's start with that last question. I don't plan on writing a third book. Again, I just kept hearing so many questions with the women's legs up in stirrups and new questions. I grew up with our bodies ourselves, and it just felt so dated. So, the example of, one is a gal came in at 22 and she said, oh, my boyfriend said I have oversized, lips. And she was talking about her vulva and how could I have a porn star vagina, she was asking. And, I was really wanting to bring up other topics, how porn affects our sexual wellness, our whole idea of sex in general, how we should look, how we should sound. So Sheology was sort of based on, I felt a need to talk about other topics. And the sequel, the second book was because one book wasn't enough. I couldn't just write one book about, women's health as it, relates more so to the vagina and vulva. So it was sort of this revolution, the vagina revolution that I wanted to start with and that I really wanted to continue with the sequel.
Awesome. Well, that's amazing. I was looking at the book and I love the cover is
Thank you.
yeah, grapefruit. So I thought that was
Tangerine.
tangerine.
Yes.
I thought that was
Yes.
pretty clever. So my final question is, what is one piece of advice you want everyone watching to share with their family and friends?
The one piece of advice is really you have to be your best healthcare advocate. You really do. Like, you cannot wait for that once a year visit. And learn. And we have this great tool called the internet, but really Dr. Google is not where I would send you. Mayo Clinic, WebMD, they have great information on just healthcare. They have it relatable, they have patient, easy reading sections. You just have to take your health in your hands. And you're never too young to learn about, what you need as far as screening tests and how you can start really living, a healthy life. So being your best healthcare advocate is what I would recommend to all your viewers, which you're doing, which I'm loving, this whole process that you guys have created is fantastic.
Yes, well, thank you so much. And thank you so much for the entire interview. We really appreciate you coming on here and chatting with us. So that concludes our interview for today. Again, Dr. Shery, thank you so much for joining us. I'm Demi Vaughn for the Power of the Patient Project, the National Library of Patient Rights and Advocacy. And thank you guys so much for watching.
Thank you so much for having me. Keep it up. Keep going.
Thank you.